Hello, everyone. This is Caroline again. It's good to be back here. Hope you had a wonderful weekend as well. And we are back with our online patient meeting and our IVF webinar. And well, today we have another topic, so stay tuned. We will definitely discuss it. And with us tonight, you can already see there is Dr. Jose. Hi, how are you? Can you hear me well?
Yeah, I can hear you. Hi, good afternoon, Caroline.
It's good to have you here, Dr. Jose. And let me just briefly tell you how it's going to work tonight. So we will simply start with an introduction from Dr. Jose, and then we will go for the most common questions. Right after that, it will be time for your questions. You know what to do, but just in case, let me remind everyone that you need to type the questions in the chat section. And after the introduction, after those most common questions, you will be able to, Dr. Jose will answer your questions one by one. So make sure to ask anything you would like to do. And once again, let me remind you that Stronger Together initiative, all those events, we had them already 41 in April, and there are so much more of those coming in May. And all of those events has been brought to you thanks to our ambassadors and partners as well. So huge thanks to them. You can see them right here. It wouldn't be possible if it weren't for all those partners and ambassadors, as you can imagine. So thank you. And as I've already told you, tonight we have another topic, which is this time vitrification of embryos and oocytes. And our presenter, our guest is Dr. Jose Luis de Pablo, and he is actually a laboratory director at Fertility Madrid and Art Vitoria. And of course, he will start with a very short introduction and presentation. And well, Dr. Jose, are you simply ready to go ahead?
Okay, Caroline, thank you for your presentation. I want to thank my IVF for inviting me here today. And okay, good afternoon, everybody. And thank you for joining us today. And well, like I said, Caroline said, I'm embryologist, senior embryologist, clinical embryologist. I've been working in this field for 20 years already. So that makes me think that I'm older than I think. But I love my job, and this is a topic, vitrification, that we're going to talk today that I really love. Okay, so here I wanted to just, I'm not just talking, but I wanted to show you a few slides so we can talk about it. And maybe some of you doesn't know about our old technique that we used to freeze the embryo. It was called slow freezing. And so I wanted to show you the difference and between these two methods. And here, okay, next one. So when we talk about vitrification, we talk about much higher concentration of cryoprotectants. We're talking about much higher cooling rates, and that means that we're not going to have ice crystal formation. That's the problem, or that was the problem. I hope nobody uses this technique now. But the problem with the slow freezing was the transformation of a liquid and solid with formation of ice. Formation of ice is the biggest problem with cryopreservation, and the thing is that it can damage our embryos, it can lyse our cells, which means that we're not going to have embryos for transfer, or we're not going, the potential of those embryos can be decreased, okay, because of that crystal formation. In this one, we're talking about the time that it takes us to freeze the embryos. In the first one, with the slow freezing, it took us about 120 minutes, which means that we spend a lot of time freezing the embryos, and we are not taking care in other things in our labs. And if we talk about vitrification, it takes us only 12 minutes. And then the main and the most important point between these two techniques is the survival rates. Okay, with the slow freezing, we get the 60% of survival rate, and if we talk about vitrification, oocyte vitrification, we're talking about 95%, and if we talk about embryo vitrification, we're talking about almost 100% of survival rate. I mean, what you need to have is a very good protocol of vitrification. You need to have a very good vitrification program to get these rates. And I mean, vitrification, as I said, is my favorite topic in IVF. And I always say vitrification is the greatest discovery in the 21st century, because, you know, has allowed us to make the cycles more affordable. When I say more affordable, what I'm trying to say is that we're going to have more embryo transfer if we have frozen embryos, we're going to be able to have more embryo transfer. And we couldn't say that with the slow freezing because of the survival rate. So this is the like I said, the greatest discovery that we had. Okay. Then in this slide, I wanted to show you the devices that we use for vitrification. And if you see the dark mark at the end of the device, we use that to place the embryos really close to this mark. So as you can imagine, the embryos are, I mean, we work under a microscope. The embryos are really small. So if we place them really close to this mark, when we warm them, we're going to be able to see them easily. So that's the way we use the straws. And then the last picture is one of the tanks that we use with liquid nitrogen, and this is where we keep them safe, and we keep them well organized. You see the different colors that we have with the straws, and you see the different colors that we have in our tanks. And this is the last slide that I wanted to show you. These are two papers that I participated in, and the one of them talks about the deleterious effect of that hormone stimulation in our patients, and the other one talks about two groups, one with fresh embryo transfer and the other one with warm embryo transfer. And what we saw is that we have better results with warm embryo transfer, not because of the vitrification itself. It's just because of the other paper that I told you about. Is because that hormone stimulation can affect the implantation rate on that endometrium because of those hormones. So this way, what we normally do in our clinics is we don't perform fresh embryo transfer. What we do is we vitrify all the embryos and we transfer them in the next cycles, or maybe two cycles after that, or 3, and we have better results because of that, because we believe, and the studies say that hormones can affect the endometrium. So what we do is we transfer that free hormone endometrium. Okay, so I finish here my presentation. We can start with
Perfect. Thank you so much for that introduction, for that presentation. Hope you
I can't hear you.
Hi, hope you
now.
can hear me. Okay.
Okay.
Thank you so much for your presentation. Thank you so much for your explanation to this topic already. And of course, we will have more about this right here. So let's get to those most common questions. And of course, then it will be time for your questions.
Okay.
So the very first one is right here. How long can the embryos oocytes be stored?
Okay, this is a good question. I mean, they can last forever. The thing is that the tanks that I just show you, they need a maintenance, and we need to check them every day, and we need to see the level of the liquid nitrogen just to keep them safe. And but the thing is that they can be stored for a long, long time.
Perfect. Thank you so much for this. And let's get to the next question we have. Do the embryos lose any possibility to achieve a pregnancy after warming thawing them?
Well, the thing is, I will say first, what we need is to achieve a good survival rate. That's the first thing that we need to do. That's why I said we need a good protocol. We need good vitrification program to achieve results close to 100% of survival rate. After that, we're talking about achieving a pregnancy. So the answer for this question is we don't lose any possibility, because the embryos have, if they survive well, they have the same possibilities to implant that a fresh embryo. Okay, and now, like I say, we're talking that when we have frozen embryos, we're going to transfer in an endometrium that doesn't have any effect of the stimulation.
Excellent. Thank you so much again for answering that question. Next one, when is the best moment for fertility preservation?
Okay, the best moment. I mean, now with this question, we're going to talk more about oocytes. Okay, so I would say the best moment for fertility preservation would be the best age should be 25. Okay, I would say that. We all know that young women being 25, they are not thinking about this kind of treatments or something like that. You know, this is like the last thing that they're going to think about. And so I always say that this should be the present of the grandmas to the granddaughters, you know, to pay for a treatment like this, for a fertility preservation treatment. So you know, that could be easy for that. And the thing is that we don't, I mean, you need to see every case, but we don't recommend to do this when you're, or the good, let's say this way, patients under 35, that could be a good age for fertility preservation. So if you're thinking about doing that, do it before you're 35, because you don't know how many patients on their 40s they say, okay, now I don't have any, or I have really less number of oocytes. The quality of my oocytes is not good, and I didn't know anything about fertility preservation in my past, you know, and it's really sad, you know, because they say I didn't know anything about this, or maybe I wasn't thinking about this before, and I didn't preserve my oocytes. So that's really sad, because now they're on their 40s and they don't have quality in their oocytes.
Yeah, okay, thank you so much. It's true, you know, so that's something that definitely should be, I would think, educated, yes, more, so that more people, more women are aware that it's actually possible to do it. So it's definitely an important.
Yeah, of course, and we talk about it a lot in different media, but you know, still, I mean, we have more patients for fertility preservation, but still is a small number of them.
Okay, thank you so much again for that. And now, what do you think about cumulative cycles of oocytes in poor responders?
Okay. The thing is, this is a really good strategy in our daily routine, but from the economic point of view, from the thing that we're gonna have more oocytes to get embryos at the end. But in our clinics, we don't recommend this when our patients are over their 38, 39. Why? Because I mean, the quality of the embryos can be compromised already. So if we vitrify them, the only thing that we can be doing is decreasing their quality, so damaging them. So that's why we don't recommend it. I mean, sometimes they don't have a partner, and they are working really hard right now, or they're just not thinking about having a baby. And you can, the thing is that you need to tell them this, okay, over 30, over 39 is not a good technique to do it, because maybe we're, instead of preserve that oocytes, maybe we are damaging them. But I would say that it's a really good strategy. Answering the question is a really good strategy, but you have to know the age of the patients, and you have to explain to them the problems. If they are over 38, 39, the problems that we can find. Maybe we're thinking that we vitrify 3 oocytes, then in the next cycles we vitrify another 3. Okay, we already have 6. But maybe what we have been doing is that those 3, if we have used them fresh, maybe we could have some embryo. And now, because we vitrify them, we're losing the possibility of having some embryo. So we have to be honest with this, and we have to tell our patients.
Okay, thank you so much again for your answer to this very important question.
Thank you very much.
Have a great evening, and
Okay.
well, stay
Thank
safe.
you too.
Bye.
Bye.